All right, good afternoon, everybody, and happy belated Martin Luther King Day. You can see we're broadcasting from New Digs. The legislature wanted their appropriations conference room back, which they had kindly lent us over the last 6 months. But with still the same cast of characters with Paul and Josh and Deirdre, and start off with our regular COVID update. It's been more than a few days. Relatively good news. The change since Friday, I think you can see fewer COVID cases, and for me, more importantly, the positivity rate down to 5.65%. I think that brings the 7-day average to 5.3%, and that's probably the lowest it's been, Josh tells me, since early December. So we're watching this carefully. Obviously, I'm also very happy that it's not just us. That Rhode Island and Massachusetts and even New York are trending, stabilizing, or even bending the curve a little bit, and that makes an enormous difference because we got college kids coming back. A lot is going on, as you know. Current hospitalizations, 27. That's over 3 days. Our current hospitalization, 1141, that's about the same place we've been for 2 or 3 months. So, as you know, that was a key metric for me, make sure we kept capacity there, and we're maintaining capacity at our hospitals. And finally, fatalities, 6682 in total, out of 400,000 now across the United States. We hit that dismal threshold just yesterday, I think. On a happier note, the vaccine update. We're still continuing to make very good progress there. Top 5 in the country in terms of getting those doses to work, getting you that shot in the arm. What a difference that makes. 221,000 doses administered to date. Almost all the people in the 1A group, which are those first-line healthcare responders and folks in the nursing home, have gotten their first dose, and another 24,000 have gotten their second dose. And we're continuing to segue to the 75 and above population. And that's worked pretty well. We haven't opened the lens wider than that at this point. But again, we wanted to prioritize people 75 and above. And we can handle more vaccine. Bring it on. But right now, we're using the vaccine that we get from the feds in a very expedited way. That allows us to take care of the Group 1A and also now some of the folks in the 75 and above. All right, you may say, why are we prioritizing the elderly? And this came up in our last meeting as well. Well, first of all, people over the age of 75 years of age are 8% of the population and 71% of the fatalities. And obviously, a lot of the folks in the emergency room, and the hospitals, and the critical care. And so it's the right thing to do. And we're continuing to prioritize folks 75 and above. We thought long and hard about who is going to be the next group that gets prioritized within this broader Phase 1B. And that'll be people 65 and over. We'll get into that in a second. But folks 65 and above are 18% of the overall population, but still 88% of the fatalities. So I think you can understand why this is going to be a really important priority for us. You can see how the fatalities by age group goes down dramatically from 80 plus to 70 and above to 60 and above. So that is what's guiding us, and we'll give you some timing on that in our next chart. Phase 1A and 75 and above, that's going right now, and we're already vaccinating hundreds of people 75 and above. I think that's probably going to take us another 2 weeks or so based upon the uptake for people 75 and above. That could accelerate if we got more vaccines from the federal government. But right now it looks like we're going to be able to open the lens and allow people 65 and above probably in a couple of weeks. We'll give you a clearer indication on that in the next 10 days. That's what our intent is going forward. Frontline essential workers will probably be at the end of February, early March. Again, that can get accelerated. If Johnson & Johnson comes online, if they free up additional doses from Pfizer and Moderna, if they're able to start increasing manufacturing, these are all speed things up. But right now, count on somewhere around March 1 for frontline essential workers. And then Phase 1C, Phase 2, May would be those workers who aren't necessarily frontline, not necessarily people interfacing on a daily basis. That's in May going forward. And it's worth reminding us that, look, congregate facilities, anything from homeless shelters, addiction, correctional, it's about 50,000 doses in total. It's about 1 week. And they are being vaccinated starting very, very soon, and they're going to be done alongside the phase, the 65 and above group going forward. And I think that will make a difference in terms of their health and safety, and more broadly, to make sure there are no spreads to the greater community. So our priorities, when I looked at that age and said, after 75 and above, let's go to 65 and above, is number one about saving lives and maintaining capacity in our hospitals. And it's also about ensuring equity, because we have learned the hard way that different demographic groups, different ethnic groups, blacks and other people of color, Hispanics, have been disproportionately hit. And what you look at in this chart here, these are fatalities by age group and by ethnic group. And you'll see that, African Americans, for example, are much more likely to suffer fatality in the 70 to 79-year-old group than, say, a non-Hispanic white. And Hispanics are even more likely to suffer fatalities in that younger age group. So that's another reason why we focus on 65 and above, what a difference it makes for these populations. Paul reminds me that African Americans are twice as likely to suffer fatality from COVID than the rest of the population. And these are all our priorities as we get this vaccination out as quickly and expeditiously as we can. So, and how are we doing that? We're doing that by launching our mass vaccination sites. This one you see in the picture from the CT mirror. That's the Pratt runway right next to Rentschler Field. You can maybe see that in the background. As you know, at Rentschler Field, you can get a test at Rentschler Field. You get emergency food support as you need. Then you can go over right here to the Pratt facility. Thank you, Pratt, for putting this together for us. We really appreciate it. 2 lines, one for the group so they can drive through and get that vaccination like you see in the other adjoining picture. And the other is so you wait 15 minutes there on site just to make sure there's no type of allergic reaction. Right now, we're getting this process going. We can handle 10 times more people there. We can handle 7,000 to 10,000 people at this facility if we get more vaccines. And Josh tells me we've got another dozen similar mass vaccination centers in the process of opening across Connecticut over the next week or two. The mobile teams, the next group, we're taking those out to congregate facilities. We're taking those out to folks that are tougher to reach. I mean, as we found out with testing, the worried well are always ready to line up for testing. But sometimes the most effective testing are other populations that we have to bring the test to them. And in this case, we're going to bring the vaccinations to them. I think I've mentioned to you that could be some of the multifamily housing where you have multi-generations living in one place. That can be, for example, in some of the churches where we can take the parking lot and make the vaccinations available to populations that otherwise might get left behind. Community clinics, we're rolling out there. Pharmacies, we're going to have the first of the CVS and Walgreens pharmacies opening up, I think, by the end of this week. All putting in place the platform to make it easier for you to get vaccinated and to make sure we have the capacity to handle more vaccinations when the federal government is able to step things up there. And finally, we continue all of our vaccinations, through the hospitals, who have been amazing partners for us throughout. Quick summary, demand is still greatly exceeding supply. That's why we have to prioritize. We're prioritizing those most at risk, those most likely to suffer the worst consequences. We've got that prioritized based on age, since that's easiest to administer and the most direct. And please be patient. I can do this now or later, but a quick update on our budget. Every quarter we give you the update, and it's good news with the caveat that things change all the time in COVID time. But right now we found our revenues are coming back stronger than we would have thought. It's not just that Melissa McCall is a very conservative prognosticator, but who would have thought the stock market would be up 15% in 2020? But that said, nobody remembers more than we do that we're getting hit and hit hard. We'll have a small budget surplus at the end of 21, which is June 30, just like we had a surplus at the end of last fiscal year. That's great. Right now, it looks like we will not have to tap our rainy day fund. And we'll have some money to pay down some of our pension. Any questions?
NBC Connecticut.
Good afternoon, Governor. Governor Cuomo reached out to Pfizer to try and directly deal with them to getting the vaccine. Have you had any thought of doing that, possibly doing it on a regional basis, similar to how it was an effort to grab PPE early on?
No, I haven't thought about that. I think we were smart to buy on a bulk basis going forward. Deirdre, do you want to talk about that?
I could grab that, Governor. We have, we're in regular contact with Pfizer, Connecticut, company with a large Connecticut presence here. Our understanding is that that's not going to be an option for states to direct purchase. I think the incoming Biden administration has made clear that they're going to continue to help coordinate statewide distribution of the vaccine, which we think makes a lot of sense. Keep an orderly process in place here, and we're looking forward to more support from the incoming administration to help increase the supply.
Yeah, and also in speaking to my colleague, my counterpart in New York, they received that message directly back from Pfizer as well. So while as soon as we saw that notice, we did our due diligence based upon the governor's directive. But as the governor and Josh stated, it's going to be still a federal response to this, and we're really looking forward to the new administration when they get started up at around 12:05 tomorrow.
Yeah, we had states competing with each other for PPE back in the spring. That was a disaster. That drove up costs and unfair distribution of the masks and gowns. This is a good way to do it, and right now we're getting what we need on time. We could use more, but on time.
And how has the sign-up been going so far for those 75 and older? How far are hospitals being booked up? Are you hearing of issues of people struggling to sign up?
Josh, you want to take that?
Yeah, I think, I'll start, and Commissioner Gifford can jump in as well. I mean, I think overall, so far, so good. We know that there are thousands of people being 75 and older being vaccinated as we speak today. We have the three main channels. People are booking appointments through healthcare providers who are reaching out, some of the big hospital systems. We've got the online sign up, which, is available in booking sites. And then we've got the team at United Way 211 who are taking phone calls as well. And we'd like to give a particularly big shout out to the team at United Way, Lisa Tepper Bates and her team, who stood up that call center on pretty short notice. They've already handled 21,000 calls and have booked 2,400 vaccination appointments just since they went live last Thursday. So they've been doing a really incredible job. Really grateful for their tremendous support.
And have we received the 50,000 additional doses promised from the federal government for this week?
We're going to get them today or tomorrow. And that's going to allow us to vaccinate a lot more folks, 75 and above, a lot faster.
Thank you.
News 8.
Good afternoon, everyone. Governor, can you speak a little bit more specifically regarding the terror approach and with well over 1 million people eligible in 1B. Was that the best approach going forward to take that tier effect?
I think was the best approach. I'll tell you, 75 and above, easy to administer. We're getting those vaccinations out quickly and frankly, a very high take-up rate. 65 and above will be very similar, quickly to administer, easy to identify who those people are, high uptake in terms of people who want to get it. I think it made a fair amount of sense. My instinct is after the 65 and above, you're going to move more broadly to essential workers, less about by age group. I think that's the right way to go.
Obviously, with so many moving parts to this, it gets very involved, and there was some confusion with teachers who were not supposed to be eligible, but a school system or two sent all their names in. What has been done to try and rectify that from happening again?
By telling people that respect the process. These are the Phase 1A people. This is the priorities for Phase 1B. Look, that said, we give a lot of doses out to the schools. They're prioritizing school nurses. If there's some doses left over, they provide that to make sure nothing goes to waste. It's not the way to go. We want to be strict about this, but we also want to make sure the vaccines get administered.
Channel 3 Eyewitness News.
Yes, Governor, just kind of following up on that question. Do different organizations have different standards for the vaccinations? I mean, for example, let's say one hospital wants to give it to someone 75 and older, while another wants to give it to someone 65 or older. Is that up to the discretion of the hospital once they receive their vaccine?
No, it's 75 and above. It's Phase 1A. It's those first-line health responders. We're pretty clear about that, very clear about that. But that said, look, if there's some mistakes that are made, at this point, we're doing everything we can to make sure the vaccines get out on a timely basis. If we find it becomes a problem, we're going to officiate that.
All right. And my final one, this might be one for Josh or Dr. Gifford. This is about the second dose of the vaccine, because we are hearing that there might be some scheduling issues that are preventing people from getting or scheduling their second dose. So is there a way to get people closer to that 21 or 28-day recommendation? And are there any health implications if someone were to get their second dose maybe 30 days or 40 days after the first?
I can take that, Governor. First of all, many of the providers are making both appointments together. So that's one way that this can be handled to make sure that individuals get their second dose scheduled. Others will be sending reminders, but we'll be continually working with our providers and getting feedback to make sure that people can get their second dose scheduled. But it is important, the second part of your question is really important to say, that there is no outer limit for getting the second dose. So if you don't get it at 21 days for Pfizer, there is no harm to getting it at 25 days or 28 days or 30 days or even 60 days. The recommendation is get it as early as 21 days, but if it's past that, go ahead and get your second dose. And it's important that people do that and they not drop off on the second dose.
Fox 61.
Continuing off that question, for peace of mind for those who are worried about when they'll be able to schedule their second dose vaccinations, can you break down how the state is receiving the correct number of second dose vaccines to coordinate with the first doses being administered?
Josh, do you have that?
Yeah, this is something that the team at the federal level has been doing very well. They have been shipping us the equivalent number of second doses right on schedule from when we received the first doses. They've been arriving like clockwork. We have the supply coming in to match up with the Pfizer doses from 3 weeks ago or the Moderna doses for 4 weeks ago. So that's actually working quite well.
If the state received that federal award of 50,000 extra doses, is there the potential for the state to receive another similar type of award or get an additional a big additional amount of doses?
Hope springs eternal. In other words, we don't know.
WTIC 1080 News.
Hi, the mayors of New York City and San Francisco today said their cities could run out of doses by Thursday. Does that concern you? Is that something that could happen in the near term around here?
Right now, our doses, those that have been promised to us, have arrived on time at the right places. And we have scheduled out those doses to make sure the vast majority of them are administered on a very timely basis. So at this point, that's not something that worries me, but we got to watch the supply chain very carefully.
And any updates or thoughts on security for Inauguration Day?
Look, I've seen a ton of security down there in Washington, D.C. I think they're going to manage that pretty well, and I think things were quiet here in Hartford, here in the state capitol, over the weekend. I'd like to think we'll stay the same for the next few days. This building is virtually empty, by the way, and most people are telecommuting through most of this week.
Would you like to see those extra precautions and all the new gates and stuff gone soon?
I would. It's the people's house. I want people to feel welcome, but let's do it safely.
News 12 Connecticut.
Hi, everyone. We've gotten a lot of questions from homebound seniors about how they're going to get the vaccine. I mean, particularly people who may not be able to physically go to their doctor's office, go to a drive-through site. Is there a plan to deliver vaccine to them and administer it?
We are launching the mobile vaccination vans, John, but Deirdre and Josh, you want to add to that?
So obviously people that are homebound and need other types of health care, many of them are connected with providers who help them get the care that they need in their homes now. So those types of visiting nurses or home care are possibilities for people to get their vaccine at home. But also many of our providers are specifically thinking about this population and working with community groups, churches, aging agencies, et cetera, to make sure that they identify the seniors in their populations who might need some additional help. We've also been saying at DPH that if you are a neighbor or a family member or know somebody who might be in that situation, that you reach out and offer to assist that individual in scheduling their vaccine.
And one follow-up question. Governor, State Representative Sean Scanlon today is pitching a pretty big child tax credit. What are your thoughts about that? Do you support it? Do you have any questions, concerns about the budget impact?
Well, yeah, I'm the guy that's got to pay for things, and I'm the guy that's got to keep the budget in balance. I'm looking at our budget right now. I see how things have changed over the last few months, all for the better. And John, I also am watching what's going on out of Washington, D.C. I think you're going to find from President-elect Biden that he's going to have a significant refundable earned income tax credit as part of his program that will certainly help a lot of working families get through this tough time.
So would you rather Connecticut hold off and see what Congress or the Biden administration does?
I would. I'd like to see what the feds are doing to make sure that whatever we do is in coordination with their efforts.
The Connecticut Mirror.
Governor, you tweeted earlier that the amount coming in is 45,000 doses a week. I just want to clarify, is there any expectation that that will increase, or should we just do the math and figure out how long it's going to take to vaccinate Connecticut?
I don't have anything certain to tell you except we're going to have an additional 50,000, so we'll be able to double up just for that 1 week. I don't have any guarantees past there. But, Paz, I think you're going to hear something from J&J relatively soon. Let's say in the next 2 to 3 weeks. That's a single dose. They could add on, significant supply, which would accelerate a lot of the timetables we have right now. AstraZeneca, the rest of the world seems to be a little more proactive on the United States. That's over my pay grade, what the reason for that is. And I also think you're finding Moderna and Pfizer are going to be able to ramp up their manufacturing. Whether that takes 3 months or 3 weeks, we'll find out.
Thank you.
The Associated Press. Connecticut Public Media. Waterbury Republican American.
Thanks very much. First off, is there any procedure in place for tracking, handling, and counting complaints regarding the appointment process?
Josh or Deirdre, do you know how we're calibrating that?
I can start. So, as we've been mentioning, there are a few different ways that seniors can get their appointments right now. So some of our healthcare providers, our largest hospital systems, for example, are handling the appointment scheduling directly. If the individual schedules through the state department, the health department's scheduling systems, that's called VAMS, then we are hearing directly from them, either if they call the phone number and ask for assistance, or if they're working through an employer or a provider, we're getting some feedback through our help desk. We're continuing to build out that capacity because we have had lots of calls come in to our appointment line, which were people asking about scheduling questions. So as we build up, we'll have 50 individuals at United Way by the end of the week who will be dedicated to taking phone calls as we build up that capacity to be able to collect more information about how things are going. We're also talking to our providers continuously. We're hearing back from them. We're learning about scheduling issues and addressing them in real time.
Okay, Commissioner, could you perhaps explain or provide us some insight, if you're able, how exactly the Department of Public Health plans to address the issues of equity and disparate impacts of COVID in the administration of these vaccinations? I'm not quite sure what it means. Will it mean that Blacks and Hispanics ages 65 to 74 in the next round will have a higher priority in distribution than others? Is it, how is this going to work, and how are you going to communicate how these decisions are being made and what order people are going to be going in?
So when the eligibility opened up for people 75 and older, it opens up for everyone who's 75 and older. And similarly, when it opens up for people 65 and older, it will open up for everyone in those groups. But as the governor pointed out in his presentation, we know that for people of color, they are younger, their more severe impacts happen at a younger age. So one of the ways we're addressing equity is by prioritizing in the next group as those from 65 to 74, and that was a recommendation specifically of the governor's advisory group to him as one method for addressing health disparities and equity. The other thing we're doing is on our implementation process, we're really focusing, as we've done on testing, we're really focusing on making sure that vaccine is available in communities where disproportionately impacted populations live. So we will be using a tool. It's something called the Social Vulnerability Index. It's a tool that the CDC has put together by zip code, and it helps us to understand where the populations that are most likely to be disadvantaged are living. We'll be matching up that index with our vaccination sites to make sure that we are getting vaccine to those communities that are likely to have historically not had similar access to care. So that has been a directive as the governor rolled out these priorities that we consider both mortality and equity, and that's the way that we're addressing it.
and I'd like to circle back to John Craven's question about homebound seniors. Are visiting nurses going to be able to provide these injections to homebound seniors? I wasn't clear on your answer, and you were talking a lot about people helping people get appointments, but I think the question goes to how are homebound seniors actually going to get the vaccine into their arms?
Yeah, so there are many different ways that an individual who's homebound could receive a vaccine. So, for example, we heard our partner from Griffin Hospital was talking about they were doing proactive outreach to community organizations to help them identify individuals who might need to receive the vaccine in their home. Many of our provider groups are reaching out and working with community agencies who work directly with the elderly so that we can identify and have a provider partner go out to serve those people. Our plan that we've been working on to administer vaccine is trying to identify these types of situations that you're asking about where the mass vaccination or the pharmacy might not be practicable for the individual. And then we'll be working with our partners specifically to identify ways that they can get out and help some of these other situations to make sure people get access to the vaccine.
Okay, and final question for the governor. There's been some news reports today that some members of the National Guard have been basically removed from inauguration security. Have any of those members been from Connecticut? Have you received any kind of report regarding that?
I haven't heard. Have you, Paul?
No, Governor, we have not heard anything of the sort. I actually think we have a better story here in terms of Connecticut. The Chief of Staff of the National Guard Bureau actually recognized our Connecticut Guard and women for the work that they're doing, particularly with their ambulatory services. Most recently, early today, he did an interview for national TV with our National Guard vehicles in the background and was very thankful for Connecticut stepping up and answering the call to the mission. So I think it's a long way to say that Connecticut's team is always doing this job for the nation.
Okay, thank you very much.
CT News Junkie.
Thanks, Max. This question is for Dr. Gifford. Dr. Gifford, what is the Department of Public Health? There was the mistake where school districts may have signed up their teachers to receive the vaccine, and these teachers got in line and scheduled appointments. What has been the instruction for if they arrive at these appointments at these local health districts or local vaccination sites? What are they supposed to do?
So DPH and the Department of Ed have been communicating with our superintendents of schools and our school districts all weekend. We sent out a communication on Friday, another one on Saturday, and we had a call with them this morning. What we have asked is that individuals who have an appointment that was inadvertently scheduled in error, if that appointment is after Thursday of this week, that they cancel that appointment. So superintendents will be working with their staffs to reach out to them, explain to them that their turn in line hasn't quite happened yet, asking them to cancel any appointments after Thursday, and then wait for notice from the governor when the frontline essential worker group is ready to be scheduled.
What if they don't cancel the appointment? I'm sorry,
Christine. Just one extra data point I wanted to add to keep this in perspective, because I've seen a lot written about this. You know, we have over 200 school districts in this state. We have over 300 private schools in this state. Best we can tell, there are only about a dozen that misunderstood the instructions. So we think the issues here are pretty limited.
Okay. But what happens if they don't cancel the appointment? What if they show up for the appointment? What is going to happen?
Well, like I said, we've been communicating with superintendents and school districts for several days now on this issue. So I'm confident that when teachers, and we've already seen this, when teachers understand, what's being asked, that they will cancel the appointments and wait for their turn.
Okay. And Governor, this question is for you, related to Representative Scanlon's floating the idea of the child tax credit. On the campaign trail back in 2018, you floated the idea of increasing the property tax credit back up to not $500 per family, but $300 per family. Is that something that you might be able to consider as part of your budget address in February?
Yeah, Christine, we got to do it all within the context of our current budget and where we are for the next year and 2 years. And secondly, what we see coming out of the federal government that maybe is addressing that as well. We thought about the property tax credit working with the legislature during the last session. I think they preferred to provide more of a discount in terms of tax obligations on pensions. So we increased the deduction they had made available there. That was a choice that we made together with the legislature.
Okay, so is there any tax relief that we can look forward to as part of your budget address?
Yeah, I mean, first and foremost, let's fully fund education. And then let's go on and make sure that we provide all the COVID-related support our municipalities and our schools need to make sure there's no reason any of them have to raise taxes. You know, from there, we'll look at other items that could be of assistance. I'm intrigued by some of the ideas I hear coming out of the legislature regarding pilot payment in lieu of taxes. And we're going to have some ideas on how we can perhaps get some additional funding to our municipalities by better funding on pilot, all ways that you can use to hold down and hold the line on property taxes. I know how important that is.
Thank you.
The Day of New London.
Hello. This question maybe is best for Commissioner Gifford. We've heard from people that are wondering, are they looking for clarity on which comorbidities would qualify someone to get the vaccine during this later stage of 1B? Apparently, I guess CDC has listed some comorbidities and then a second listing of them. And the question is, has the advisory group or will the advisory group recommend adoption of all of those comorbidities that the CDC has identified?
Yes, the advisory group recommended to the governor that he reference the CDC list of conditions that have been shown to cause more severe illness or death, been associated with more severe illness or death with COVID-19. So that's the list that we plan to work off. CDC is monitoring the research and the data regularly. They've added to that list, and so we will reference that most likely when we get to that part of phase 1B.
Okay, thank you.
The Hartford Current.
Hi, everyone. Governor, you've mentioned a few times that you are optimistic that the new presidential administration will help with some of these issues and will make the vaccine rollout a little more smooth. I'm just wondering how specifically might we see that manifest itself in the coming weeks?
I firmly believe that they are going to put their foot on the accelerator when it comes to the Defense Procurement Act, making sure that Pfizer and Moderna have everything they need, especially in terms of the customized equipment for mixing the vaccines that would allow them to double or triple manufacturing capacity. I think that would be absolutely invaluable and key. For those other states that maybe having a hard time getting things administered, I think they'll be very helpful in terms of a training course so more people are able to administer the vaccine on a timely basis. I think it's a good time to have this new leadership.
Thanks. And so also, we've mentioned a couple times the teachers who were mistakenly told to get vaccinated. We've also heard about people who are 65 to 74 who have already been permitted or told to get vaccinated. I know you have tried to have kind of a lenient approach. I'm just wondering if we've sort of begun to hit up against the edge of that, where you want to kind of enforce, like you said before, to respect the process.
Look, if I think it's being abused, if I think it's not an honest mistake, you're right. I think we're going to have to be strict because otherwise people feel like they're being cheated and they're being, not treated fairly. And I appreciate that. Previous question on the comorbidities and what is included and what is not. I mean, that's going to be, there's a lot of nuance there. That's why doing 75 and above and 65 and above, it's easy to delineate, easy to administer on a timely basis. And sadly, a lot of us have some type of comorbidity, so at that age. So I think that's going to accelerate the vaccination process. But you're right, it gets a little more complicated once you get to essential workers and comorbidities.
And then last thing, yesterday a really large number of apparently negative tests were added to the state total, and I'm just wondering what the explanation was for that, why that happened.
I don't know. Do you know, Josh?
Yeah, so the team at Department of Public Health has been working for 11 months now with, who came into this pandemic with some pretty antiquated systems, have been working to upgrade those systems, and in the most recent upgrade, discovered a particular code that wasn't pulling in certain negative tests, and this goes back to like May. So that's those tests that we added into the totals are spread out over a pretty long period of time, and they've just as part of the upgrade process, we've added those back in.
Got it. Thank you, guys.
Hearst, Connecticut Media.
Hey, good afternoon, Governor. Over the weekend, there was a large birthday gathering in Bridgeport, and it drew the attention of police. Given that private residents currently face up to only $500 in fine, and now there's been a $10,000 fine in the same city in Bridgeport, would you consider hiking the fines up for residential COVID violations?
I would if I find this is an abuse that's getting more rampant. In the meantime, I want to make sure we exact the fines that these people should be served if that is exactly what happened.
And just one correction, the individual, based upon the news article from your publication, lived in Trumbull, Connecticut. I want to say that his employment is in Bridgeport, Connecticut.
Thanks for that. And then I understand with the school districts that have been talked about today, are you glad that the vaccines are being used? Is there something you want to do to stop this from happening? And do we have a head count specifically on the number of people that were vaccinated early?
Let me just start in this sense. We found that some states, we went through this before, maybe Florida, for example, first come, first serve, Bonnie bar the door, everybody over a certain age, and they had long winding lines, and there was a heck of a lot of frustration. We found other states were sort of micromanaging things, really coming down hard, severe fines and the such if mistakes were made. If the mistakes are made purposefully, that's one thing. If mistakes are made and it's accidental, I think that's a very different thing. So far, I think we got a pretty good balance, and we're getting people vaccinated on a timely basis. And that's the most important criterion for success for me.
Thanks. And then last question. California said that they're, taking a pause on some of the vaccinations on one batch of Moderna after there were some possible severe allergic reactions. Would you consider halting the use of that vaccine if we saw similar reactions here in Connecticut?
I think I'd probably ask my head of public health.
So what I can tell you about, and it's important for the public to know that CDC has a very rigorous process for monitoring the incidence of adverse reactions to the vaccine. They have 4 different ways where people can report, and they're tracking that and putting out numbers regularly about the number of adverse reactions. It's not unusual when you're vaccinating millions of people to see adverse reactions but they're very rare, and that's what people should know. They're very rare, and if you screen for the people who shouldn't be vaccinated, they're even more rare. So I want people to have confidence that, yes, there have been adverse reactions, but they are rare, and I also want them to have confidence that CDC is tracking this and monitoring this very carefully, and they will notify states if they believe that they're seeing a pattern of concern that we need to take action on.
All right, I guess I'm getting the signal here. Hey, Deirdre, you did extra duty today. Thank you, as you always do. And we're just all part of your backup band today. Let me just say, Paul Hughes asked an interesting question about some of the frustrations. What do you do with the complaints? Here's what I'm hearing. I'm hearing, let's face it, we're doing everything by appointment. You can get the telephone. A lot of it's online, ct.gov, COVID vaccine. little bit of frustration from some of the people over 75 in that regard. I'd say the other 95% of the frustrations we hear are from folks who just want to get the darn vaccine. How come I'm not at the front of the line? How come I'm not considered more essential than others? And here I got to plead with you. I mean, Deirdre and the Vaccination Advisory Group and myself and others, we're doing everything we can to get the vaccines out in a way that promotes public health and your particular safety. And I think right now our limiting factor is not the urgency and the need for you to get the vaccine. It's us getting more vaccines. We're getting those shots in the arm as well as any state in the country, of which I'm so proud of our team. Going from 75 to 65 in the next couple of weeks, I think you've got an explanation of why we did that. There are a lot of other ways we could have done that, but I think it's going to save lives, free up hospital capacity, and we can get it done faster and more timely and make sure you're next. Hey, thank you, everybody. Appreciate your being here.